Through the Come Care With Me program, a partnership between Iowa Caregivers Association and PHI, Iowa's elected officials are learning firsthand how important direct care workers are to Iowans. Senator Jeff Danielson and other elected officials are learning how direct care workers touch the lives of older Iowans and persons with disabilities and their families, employers, our local communities, and economies. Many experts predict a tsunami of needs with the aging baby boomers. Iowa needs at least 12,000 new direct care workers over the next few years, but these workers are hard to find and keep. An investment in this vital sector of the health and long-term care workforce will help us to avoid a tsunami of unmet needs. Direct care work is physically, emotionally, and mentally demanding.
We get here, get them up, get them to their therapies. It's nonstop. It's nonstop.
Senator Jeff Danielson is a firefighter and care provider, but even his eyes were opened.
There's a value in our community that we often forget, and it's the value of being able to walk in somebody else's shoes, to understand what their daily life is, so that when, as a policymaker, I have to make a decision to provide resources or not, I understand that our communities are stronger because of what they do. To see it up close and personal like today, it's invaluable. And I'll never forget it when we're sitting in the Senate and we're talking budgets and numbers and programs. It's always the people that you know that are behind those things that matter the most. Mm-hmm. It surprised me how physical that work is. You know, I get to work out at the firehouse, I get to put fires out, and that's a very physical job. But you wouldn't think that a job like this would be physical, but it is. I was already breaking a sweat about halfway through the first thing that we did. And that's important. That's back-breaking work that most people don't know is even going on in our communities. And until they know that and are aware of that, it's very difficult for them to care about, as a community, why we have to support it. And so direct care workers bear the burden of that back-breaking work, but they're too invisible to us. We need to know that that's going on, and the public needs to be aware of that. Mm-hmm. I was surprised at how patient and careful and caring the providers have to be. I don't think the public understands how important direct care workers are. We all are able to go through our daily lives and take for granted just being able to get dressed or get up out of bed. And the patients that they care for here, that's a daily occurrence that takes 10 times the effort. I think it's important that the Kellys of the world that I worked with today have their story told. But Kelly gets up and goes to work every day, and hardly anybody knows the value that she brings to the community. And being able to share those half hour, an hour today with her is very important. And I would wish this was everyday news, because Kelly is an everyday hero, and more people need to know about the value of her work. And we need to make sure that they are paid well, that they have benefits, so they can take care of their families too, just like they take care of the families here.
Direct care workers are important to family caregivers.
It's the little things that people don't think about.
Right.
I mean, we stand up all the time. We don't realize that's good for us.
Right.
And people that are bedridden don't get that choice.
And then also, too, to interject, is that to try to train families to do this, it takes a lot. Mm-hmm. But when we come in and get the training that we need, you know, it's very helpful for the family to continue on with their life and go to work and do everything that, you know.
Everything we take for granted takes all that much more to try to make it work.
What I want to get across to you is direct care staff have a lot of needs, wages, benefits, they're not appreciated. We're the hands and heart of long-term care. Absolutely. If we weren't here, nobody else would be.
Right.
Health and long-term care employers find it difficult to find and keep direct care workers.
Turnover is a real significant problem, as it is in any business. It feels to us as if it's a fairly consistent turnover. It makes turmoil for our residents. Our residents, based on the fact that all of our residents here all have cognitive difficulties. One of the things you really need to do is keep things constant, to have the same faces, the same places, the same activities on an ongoing basis. And it's very stressful for them to see new faces all the time, to have different people all the time. It's sort of ironic that baseball players are making and football players are making what they're making, and healthcare workers are making $8 an hour. And these, as I put it, are the hearts and hands of what healthcare is all about, and yet we pay them the least. And it's just really, socially, it's unconscionable.
I was glad that I was able to share with someone like the senator because of the position that he has. And I was glad that he was able to pitch in and do hands-on, because when you're able to touch, use your hands to touch and you get more feedback, and it makes you to remember.
As a firefighter, I sometimes get called a hero, and as a humble Iowan, it's nice to hear. But when you see the direct care workers here, you know that they're the everyday heroes. And if we don't get a chance to walk in their shoes occasionally, understand somebody else's perspective, then we don't make the best decisions that we can. And so I'm thankful for the opportunity to be here today and do this.
If you care about Iowans receiving good care and support, contact the Iowa Caregivers Association to see how you can get involved.